This is a 3-year-old boy who presented with tooth pain and left-sided facial swelling. So you can see there is left-sided facial swelling inferiorly over the left body of the mandible, superiorly over the left maxilla involving the cheek. It involves the nasolabial fold on the left, and more superiorly the medial canthal region. But there's really no sign of post-septal orbital cellulitis. So again, his complaint was tooth pain. So let's look at the teeth. And in kids, there's primary teeth and there's permanent teeth. And the permanent teeth are often developing deep and lingual to the primary teeth. And they develop in these bony crypts. And you want to be careful not to call the radiolucent tissue around the mineralized tooth periodontal disease or decay. This is just normal part of the bony crypt. And so it's a little bit difficult on axial section. So for kids in the primary or mixed dentition, I prefer to look in the coronal plane. So let's get to the teeth. I'll do maybe a little windowing. Okay, so now it's more clear that primary teeth are here, developing permanent teeth are here. And you can kind of scroll through. So if you look at the primary teeth, there's just a lot of areas of coronal tooth loss and demineralization on multiple teeth. Here, here, going back to the molars, here and here. So this is extensive decay in a 3-year-old. And you may also notice that the primary mandibular teeth are not really affected. This is the classic pattern of what's called early childhood caries. It's also called baby bottle tooth decay or nursing caries, but I think early childhood caries is the most appropriate. You often see it in cases where a little toddler goes to bed with chocolate milk or milk that mom or dads add sugar to, and so they're just frequently drinking sugary beverages all night. The mandibular teeth are thought to be spared because of the cleansing action of the tongue and the pooling of the saliva in the floor of the mouth. So one of the potential consequences of tooth decay involving the primary teeth is that it can affect the permanent tooth buds developing. And so let me show you something here. So here we have decay on this primary maxillary molar, and the pulp is probably involved given the extent of decay. Kind of see it here on the other side as well. And likely the root is affected as well, and you can see the root ends right where the permanent tooth is developing on both sides. So I can't say for sure that this infection is spread or is affecting to the permanent teeth, but it's certainly suspicious for that. And it can have consequences. The permanent teeth can be dysplastic and malformed if infection occurs during development. The other thing I want to point out is that primary tooth apices, the root apices, when they're still developing, they have a little periapical radiolucency around them. Let me find a good example of that. So right here, in an adult, you see this is going to be decay more often than not. In a kid, the apices often finish forming 2 years or so after you first see the crown in the oral cavity. So this could be just the development or the maturation of a fully formed apex. You can kind of see it on the other side as well. It also could be decay, especially in the setting of the coronal decay. And so sometimes in kids that can be a little confusing. One thing that'll help is look at this image right here. In kids, the infection of the crown often breaks through the furcation. And so it causes bone loss, not necessarily in the periapical region, but in the furcation area between the two roots. Let me zoom up for you so you can see it. In adults, when you get bone loss in the furcation area, that is typically from periodontal disease. But in kids, in the primary dentition, it's often from decay. So look at the furcation here. You have one root going this way, another root going this way. And right here, there should be bone. And so on the other side, there's bone in between. And there's nothing here. So this is definitely decay. And you can see it. It seems almost contiguous with that bony crypt of the developing permanent tooth bud. So again, this is further suspicion that this infection is affecting the developing tooth. So finally, just to summarize, this is a case of early childhood caries with odontogenic facial cellulitis. And the key points are that, one, early childhood caries is important because it can lead to facial infection like in this case, but it can also affect the developing tooth buds of the permanent teeth. The other teaching point is that there are often periapical radiolucencies in developing teeth or teeth that haven't fully matured their apices, which can take 6 months to 2 years after first eruption. So you don't want to call it decay. And then finally, the last teaching point is that the furcation is often involved in decay in primary teeth, as was the case here. But furcation bone loss in an adult is typically from periodontal disease. And I guess one more thing I would add is, again, the sinus is opacified here. So you want to at least consider odontogenic sinusitis. Now, the decay is involving the primary teeth, and the actual floor of the sinus looks intact. So I don't think this is odontogenic sinusitis, but again, when you see sinus opacification and maxillary tooth decay, you want to at least consider it. And that's it. That's the summary of the key teaching points of this case.